So according to the Cunningham textbook, we are making a markings in the gluteal region. There is given number 5 and number 6. Number 5 is you make a circle like a half moon shape from the center of this vertebral column sacrum is there. You make a circle like this, surround to the iliac crest up to below this. Already we are removed. So you make a one circle, half circle here, then another circle from here, the natal cleft to the gluteal fold, below the gluteal fold, up to here, because gluteus maximus muscle is inserted here, gluteal tuberosity in the femur. Otherwise, we won't identify where it is insertion. In the upper extremity also, pectoralis major muscle that is inserted at the here, gluteal, bicipital groove. Here the gluteal tuberosity present here. So that's why we are removing the thigh part also. So first you are making like an incision. You make a one line from here to here. Then half circle from here to the around the celiac crest. Okay. Next another line, sixth line from here to up to here. So now you remove the flap of the skin from the what you are make the 5 number and 6 number according to given Cunningham textbook. After remove the skin, we can identify the immediately superficial fascia fat. More amount of the fat is there. More amount of the fat, and also cutaneous nerves we are identifying. After remove the fat, deep fascia is there. So the deep fascia it cover whole gluteal region, cover the gluteus maximus muscle. So after remove the deep fascia, then we can identify the exposed. First is the gluteus maximus. It is a fan-shaped muscle. Gluteus maximus it covered. It takes origin from iliac crest, posterior gluteal line, sacrotuberous ligament. Then it is insertion at the gluteal tuberosity. After cut the gluteus maximus, we are reflecting lateral side. Then we can identify below gluteus medius is there. Okay, gluteus medius. Then below the gluteus medius in the center, piriformis muscle is there. It is a spindle shaped muscle. Piriformis. It is also called the key muscle. It crosses the greater piriformis muscle. It separates the greater sciatic notch into two parts, above the piriformis, below the piriformis. So automatically this become a two folds like a foramen. From that, superior gluteal vessels and nerves, inferior gluteal vessels and nerves are coming and going to supply to the gluteus maximus and medius muscles. Next, not only this, superior gemellus, inferior gemellus, quadratus femoris muscle we are identifying in the gluteal region. After cutting the gluteus medius muscle, it is the deepest muscle in the gluteal region. Gluteus minimus muscle is there. So then the dissection is completed. Then maximus, medius, minimus, piriformis, superior gemellus, inferior gemellus, quadratus femoris, operator internus and externus muscles. Those muscles we are identifying in the gluteal region. Not only this, superior gluteal vessels, inferior gluteal vessels and nerves, posterior cutaneous nerve of the thigh, and great longest and thickest nerve in our body is the sciatic nerve, also coming from the gluteal region, greater sciatic notch that is coming and cross to the gluteal fold, enter into the thigh. Then in the popliteal fossa, it is sciatic nerve is divided into tibial and common peroneal, then going to supply to the leg as well as the foot region. That is the dissection we are doing today's. First you reflect the skin, superficial fascia and deep fascia you complete today. Tomorrow we can show the muscles, gluteus maximus, undercover. They may ask the question, describe the undercover of the gluteus maximus muscle. Undercover muscles and gluteal vessels and nerves. How the undercover of the deltoid muscle asked in the upper extremity, The same question may expect describe the undercover muscles of the gluteus maximus. So today you remove the skin and superficial fascia. Tomorrow we can show the muscles. Okay. After remove skin, superficial fascia and deep fascia, then we can identify the gluteus maximus. See here, this is the gluteus maximus muscle, both sides. It is look like a fan-shaped muscle. It takes origin wide from the posterior gluteal line, iliac crest, sacrum, sacrotuberous ligament. It takes and extend downwards and going to insertion at the here gluteal tuberosity that is present in the posterior surface of the upper end of the shaft of the femur. See here we can identify the gluteal tuberosity. Exactly it is. So gluteal tuberosity is here. So gluteus maximus insertion at the gluteal tuberosity. What about this? Linea aspera. Okay, linea aspera. This is the gluteal tuberosity. So now I am separating from here. One inch lateral to the sacrum. Next from here. Why you are cutting here? It takes origin from here. Always we are separating from the origin. Now gluteus medius. See, between the muscles there is a fascia is there. This is a fascia. Now we are separating the fascia from the medius and maximus. So while separating here, you should take care to cut the sciatic nerve. See, this is a sciatic nerve. If you are mistakenly, if you cut the deep, no, we lost the sciatic nerve. This is the gluteus maximus. The fat I am separating. This is the gluteus maximus. You told no the origin sacrotuberous ligament. I can show that sacrotuberous ligament now. Here, sacrotuberous ligament. The strong band. Sacrotuberous ligament. So now I am separating the fat from. It is also same like this. Sacrotuberous ligament. Ischial tuberosity to sacrum present here. So it attaches the sacrotuberous ligament like a band. Like this band. From sacral to ischial tuberosity to sacrum. Like this it make a band. So greater sciatic notch, now it become a foramen. Greater sciatic foramen. Okay. So if there is no this tuber ligament, greater sciatic notch. When it is attached from the ischial tuberosity to sacrum, sacrotuberous ligament. There is another ligament is there, sacrospinous ligament. Now that is separate here. It is look like a B shape. It is look like a B shape, like this is greater sciatic notch, lesser sciatic notch. So through the greater sciatic notch, sciatic nerve, superior and inferior gluteal vessels and nerves, and also pin structures also coming from here. Then after entering the gluteal region, cross to the ischial spine here, then again enter into the perineum through the lesser sciatic notch or lesser sciatic foramen. I can show now. That separate the greater sciatic foramen into two, above the piriformis, below the piriformis. So 99% always sciatic nerve coming from the pelvis through the greater sciatic foramen below the piriformis. Chudandi, see, this is the piriformis muscle. Okay. See here. This is the piriformis muscle. It is a key muscle present in the gluteal region. This is a piriformis. This is a piriformis muscle. This is the below the piriformis. This is above the piriformis. This is the sciatic nerve. What is this?
Sciatic nerve.
This is a sciatic nerve. I told now here, while continuous sitting, there is no musculature. So if you are sitting continuation on the margins of the tables, benches, stools, it compressing sciatic nerve. Just see, if you are lifting, it is crossing from here only. There is a one muscle is there, it is acting like a bed. This is a quadratus femoris muscle. See, this is a quadratus femoris muscle acting like a bed. It is sleeping or sitting, how, whatever. See here, if we lift here, we can identify quadratus femoris muscle. In posterior cutaneous nerve of the thigh also going from here. What is the nerve supply to the gluteus maximus? Inferior gluteal vessel. See, below the piriformis, these are the inferior gluteal vessels and nerves. So it is going to supply to gluteus maximus. What about the superior gluteal vessels and nerves? Where it is going to supply? Gluteus medius and minimus. Okay? So this is the medius. Now I am separating this medius. So this is the medius. So gluteus maximus below Gluteus medius. Now I am separating the gluteus medius. From where it takes origin, gluteus medius? Yes, the lines between the posterior gluteal line and anterior gluteal line. So now I am separating this. See here the blood vessels above the piriformis, these are coming. These are all superior gluteal vessels and nerves coming above the piriformis. So these are the superior gluteal vessels and nerves. So below, this is the gluteus minimus. See, gluteus minimus, gluteus medius, gluteus maximus. So gluteus maximus. Immediately we can identify the medius. This is the piriformis muscle. Piriformis muscle, key muscle. So this is a sciatic nerve. Inferior gluteal vessels and nerves. Next, this muscle. What is this muscle? Quadratus femoris muscle. Next, not only this, and also we can identify superior gemellus and inferior gemellus. I can set condition. See here, sciatic nerve. This is a piriformis muscle. This is a piriformis muscle. This is a inferior foramen, inferior gluteal vessels and nerves, as well as the sciatic nerve is coming below the piriformis. So this piriformis crossing to on these muscles, superior gemellus, inferior gemellus. These are the two muscles. Between these two muscles, there is a tendinous part is there, obturator internus. This middle one is the obturator internus. So this is a superior gemellus, this is a inferior gemellus, obturator internus. These three muscles are going where it takes origin? Ischial spine. This is the ischial spine. From here, superior gemellus and inferior gemellus muscle takes origin here. Where it is insertion? Trochanteric fossa here. Here, greater trochanter medial surface region, superior gemellus and inferior gemellus muscles, as well as obturator internus muscle, insertion at the medial surface of the greater trochanter. So these are the three muscles: superior gemellus, inferior gemellus, obturator internus. What about this muscle? Piriformis muscle. What about this? Quadratus femoris muscle. What is this muscle? Medialis. What is this? Gluteus minimus. So these are the muscles present in the gluteal region. Minimus. Minimus. Nerve supply is superior gluteal vessels and nerves. Medius also going to supplied by superior gluteal vessels and nerves. This is a gluteus maximus, inferior gluteal vessels and nerves. After separating this, medius visible, piriformis muscle, it is a key muscle. Below the piriformis, sciatic nerve is coming. After lifting here, quadratus femoris muscle. Next, towards the middle side, three muscles: superior gemellus, inferior gemellus, obturator internus. So these are the muscles present in the gluteal region. So sometimes they may ask the question, describe the undercover of the gluteus maximus muscle. So you can write what are the structures you are seeing here: medius, below minimus, piriformis, superior gemellus, inferior gemellus, obturator internus, quadratus femoris. Blood vessels: inferior gluteal vessels, superior gluteal vessels. Nerves: superior gluteal nerve, inferior gluteal nerve, sciatic nerve. Not only this, and also we can identify posterior cutaneous nerve of the thigh. I can separate. So this is the sciatic nerve. It is the longest, strongest, okay, thickest in our body. Sciatic nerve. What is the root value sciatic nerve? L4, L5, S1, S2, S3. Sciatic nerve. It is going to supply to the gluteal region, hamstring muscles, back of the thigh, and the back of the leg, lateral compartment of the leg, anterior compartment of the leg, dorsum of the foot, sole of the foot. So, whole maximum nerve supply by this sciatic nerve. Sciatic nerve. Sometimes they may ask the question, what is sciatica? What is sciatica? May compressing here. So, while standing, immediately we are feeling some numbness, tingling sensation is there. So, where it is going to supply, that area going to numbness, tingling sensation is there. Sometimes our grandmothers, they are saying, no, medial side of the thigh, lateral side of the thigh, and posterior compartment of the thigh. It is the posterior region, whole region, that is sciatic. It is the anterior compartment region, that is a femoral nerve compression. Medial compartment, obturator nerve compression, somewhere in the pelvic region. Okay, remember this. This is a gluteus maximus, medius, minimus, gemellus, piriformis, obturator, quadratus femoris. Nothing like this. Maximus is there, but here no musculature. This is, it's a sitting, no? This is ischial tuberosity. पकड़ के देखो इधर, ischial tuberosity. एक मिनट, मैं ये नहीं करूँगा.